Welcome back to Studio 10, everybody. It's time for our weekly segment On Your Health, where we discuss important medical and health topics with the doctors of Florida Medical Clinic, the Bay Area's first clinic to merge both primary care physicians and specialists all under one roof.
And today we welcome Dr. Kanchan Kamath, a doctor of internal medicine, to tell us more about her area of expertise and the growing role of hospital medicine. Dr. Kamath, welcome to Studio 10.
Thank you. Thanks for having me here.
So you've got internal medicine and family practice. What's the difference there?
Well, the major difference is there are a lot of similarities, but the major difference is in the training. With internal medicine, there is a lot of focus on adult medicine, so it's an in-depth adult medicine training, so to say. Whereas family medicine, they get trained. It's a broad training or a broad overview in adult medicine. In addition to that, they get trained in OBGYN or obstetrics, gynecology. They also get trained in sports medicine, a little bit of surgery. So they do a little of everything. Unlike us, we take care of patients from the age of 18 onwards.
Okay, so would you be considered a specialist then, or what exactly?
We're specialists in taking care of the whole patient.
Okay, wow, you specialize in a lot.
Yes, we specialize in a lot. Yeah,
so
I would say that.
What made you interested in that particular type of medicine?
Well, for one, you can, when you become an internist or when you get trained as in internal medicine, you can subspecialize later on, like, for example, in cardiology or nephrology or so on. But for me, that would be another 3 years of additional training. What I liked about internal medicine was the fact that you get you're a diagnostician, as well as you take care of, you treat the patient as a whole person.
She's like house.
Yes, right. And as you treat patients, though, I mean, you obviously you go to school for that and so forth, but your interaction with the patients has to be almost as important as getting the diagnosis correct, right?
Definitely. Putting the patient at ease is very important. They have to be comfortable with you because, at the end of the day, they have to be able to trust their physician.
Right.
And you are the key. For example, even if they see a number of specialists, at the end of the day, you're integrating their care. You're providing that comprehensive care for that patient. And so it becomes very vital that you put the patient at ease and you take care of them and you build a rapport with them.
You have a very, you're very approachable,
yes,
I think.
She's got a great bedside manner. You can tell already.
Yeah, I'm not nervous at all. It's fantastic.
So in having to sort of integrate all of their different specialists together, then that communication's got to be really critical for you.
It is. It is very important that you be able to communicate not just with the patient themselves, but also with the specialists that take care of them. And you have to understand, with the specialists, they're taking care of one organ system. A cardiologist would take care of the patient's heart-related problems. The nephrologist would do so with the kidneys, and you as the patient's internist should be able to kind of put that all together and provide the comprehensive care that the patient needs, and that becomes very important.
And sometimes it's also important what the patient doesn't say as compared to what they do say.
Exactly. You have to be able to read that, and also what becomes important is being able to educate the patient. It's not just a matter of handing out pills or telling the patient this is what you do. It's also very important that you communicate well with the patients. You explain to them what is wrong with what is wrong in terms of their health and why you do certain things in terms of medical care, and put it simply. That to me is very important, and many times we do tend to miss that. We speak in a language that most times patients don't understand, and we have to be able to break that barrier, and that is very important for the internist to do.
When something tells me that you become sort of the interpreter when all of the different information starts coming in from the specialists, and you have to regurgitate it to the patient, that really becomes your area of needing to focus.
Correct.
Communicating with them. And how much easier does it make it for you to be a part of Florida Medical Clinic where you have the support staff all there, you have the specialists right there? How much easier is it?
It is very easy, and that's what I like about multi-specialty groups, the fact that there is open communication. You sort of build a rapport with the other specialists. The computer systems definitely help because you have access to the medical records. and that makes it so much simpler. For example, if there is something that I need to know about the patient, I have it at my fingertips. I can go into the computer, find out which specialist the patient has seen. If the patient is unable to provide me with that, with the details of that information.
Sure.
So that makes it so much simpler. And, in addition to that, I know that I can pick up the phone and call the specialist if there is something that I'm concerned about. And if I had not been aware that the patient had seen a specialist, it makes it so much simpler for me to talk to the specialist and get that information.
And Florida Medical Clinic, as we've pointed out, way ahead of the curve in regard to electronic medical records,
Correct.
which is a tremendous advantage for patients, as you just pointed out. Is there anything else out there? What's new and on the cutting edge? FMC is always right out there. You guys working on anything special right now, or on the verge of breakthroughs or anything?
Well, I don't know in terms of breakthrough, but I do know, they're far ahead in the game in terms of electronic medical records. It is, there is still a lot of work to be done, with all of the changes healthcare is seeing, and that is a given, for all of us in healthcare. You are going to see a lot of changes, and also in terms of education, they make sure that we are on top of our game. We know how, what is new out there, and we are trained accordingly. And I think that's one of the best things about Florida Medical Clinic. They make sure that we are up on most of the new and happening in medicine.
All right. If I ever have an unidentifiable disease, I know where I'm going.
That's absolutely right there.
Thank you.
We're one of the best diagnosticians, I can say that.
There you go.
Thanks for being here. Hey, if you'd like to learn more about the latest advances in patient care and medical research, visit Florida Medical Clinic online at floridamedicalclinic.com. While you're there, you can locate the office nearest you, learn about their doctors, and even request an appointment. Don't you get tired of dealing with sick people all the time? Don't you like to be around healthy people just every once in a while?
I do see healthy patients. I do.
Oh, there.